Rub your palms and place it on your closed eyes. Complete darkness is there. In this darkness, you open your eyes, give a light massage to your eyeballs, and let the light in very slowly. सभी का एक बार फिर से स्वागत है। सब लोग कैमरा ऑन कर लीजिए। All of you are welcome. Please put on your cameras. And now if you have, hello. Sure. Okay, let me see. You had some difficulty in logging in?
No.
Am I legible? सुनाई दे रहा है प्रकाश
sir.
जी आपको? आवाज
Yes,
आ रही
sir.
है?
Yes, sir. हाँ सर, ठीक से आ रहा है सर।
पता नहीं कौन सा
नहीं वो
लगा के she is trying to log in and unable
no,
to.
that's what sir. Sometimes it takes longer time to log in, sir. After clicking, it will be in waiting room.
I can't see anyone. Yes, she's here. Okay. So now, if you have any questions, अगर आपके पास मन में कोई प्रश्न है, आप पूछ सकते हैं. This is your time. ये अब आपका समय है. Or if you don't have any questions, we will go ahead. Okay, so we did yesterday what we did. We have done heart. Yesterday we did heart. Now today, let us see how we can. Let us see joints, which is another important thing for which you keep getting patients. Joints के लिए patient आते रहता है. तो आप आइए joints देखें. एक कोई लिम्ब ले लेते हैं. यहाँ पर हमारे पास कौन सी
नी जॉइंट से सबसे ज्यादा होते हैं. नीज रिप्लेसमेंट.
we will take everything, don't worry. अब ये दिख रहा है?
सर थोड़ा छोटा कीजिए, तो छोटा पिक्चर।
अभी छोटा
हाँ
करूं?
सर,
नहीं, थोड़ा बड़ा कीजिए।
नहीं बस।
ये बस है?
हाँ बस बस सर।
हाँ बस।
ऐसे दिख सकता है, ऐसे दिख सकता है।
नहीं,
हाँ बस।
थोड़ा
हाँ,
छोटा कीजिए सर। नीचे
थोड़ा
वाला
छोटा
नहीं
करूं?
दिख रहा। थोड़ा सर, थोड़ा और थोड़ा सर।
फिर तो इतना ही आ गया। ये पैर के बोन्स है। So if you want to allot energies, you can allot like this. इसमें खास कुछ बताने का नहीं है। ये हिप जॉइंट है। दिस इज हिप जॉइंट, है ना? जब एवियन होता है, एवास्कुलर नेक्रोसिस, वो यही होता है इस जॉइंट में। ठीक है? सो यू कैन यूज दिस फॉर बोन्स। Is it okay? You don't need any explanation. ये ठीक है ना? इसमें कुछ एक्सप्लेनेशन नहीं चाहिए?
यस
सर
सर।
डिवीजन नहीं मालूम पड़ रहा है इसका।
नहीं मालूम हो रहा है। पैर में एंकल जॉइंट से नीचे, just below the ankle joint, all bones are hotness. Why hotness? Maximum yang. Maximum yang.
ठीक है, समझ में आ गया।
Then you have two bones between knee joint and ankle joint. दो बोन है, नहीं? एक बाहर का और एक अंदर वाला चौड़ा। ठीक है? तो जो चौड़ा वाला बोन है, टिबियल बोन जिसे कहते हैं, वो छोड़ दीजिए। जो बाहर है वो ज्यादा यांग है। जो लेटरल साइड में है दैट इज मोर यांग। तो हॉटनेस के बाद क्या आएगा? हीट। सो दैट लेटरल साइड में जो पतला बोन है, थिनर बोन, because that is outer side, that is more yang, so that is heat. Then inner side, the broader bone, that is wind. Then comes femur bone, ऊपर का, नी जॉइंट से हिप जॉइंट तक, up to the ball, that is humidity. And the socket and the hip joint, so-called hip joint, pelvic bones, where it is connected, ये जो pelvic bone है, जहां ये connected है पैर, that is dryness. नीचे का हिस्सा, और ऊपर का हिस्सा which is connected to your trunk, pelvic trunk, that is coldness. अगर उसमें भी कोई बात है, even if you have inside that, if you have particular portion, then in that you can have again 6 energies. The lower portion, the loop from where there is a hole and the nerves go, nerves travel from there, that is coldness. Just above that, the junction, जो junction है पैर के बोन का और हिप के बोन का, that is dryness. उसके ऊपर humidity, उसके ऊपर wind, उसके ऊपर heat, and the pelvic trunk का जो हिस्सा है ऊपर वाला, that is hotness. ठीक है? Is it all right?
Sir, about the hip joint, is it from left to right or is it like only one side?
It
From
is
left to right?
progressive. It is from bottom to top, most yang to most yin. Yin is that portion which is joined to the trunk, the body, the pelvis. That is junction, which is not free to move. Where is the maximum freedom for movement? Below the ankle joint. The bones there, they can move freely. Even in that feet, you can have 6 energies. Shiva, you got it, what I said?
Yes, sir, but yeah, I understand the bottom one is yang. My question is related to the hip. Hip itself, like in the pelvic region itself, you are dividing as a 6 energies, right? That is from left to right or right to left, I am confused.
We are talking of total bone. When we will take left and right, then it will be a cyclical distribution. Isn't it?
But in your second diagram, you mentioned on top itself 6 energies, right?
That is also vertical, linear. See again.
That linear is from outside to inside or inside to outside? I am confused.
Top to bottom.
Top to bottom.
Top is hotness, just below is heat, just below is wind, then humidity, then dryness, and then coldness.
So
because
both
this
the leg
whole
has...
thing is, one moment,
Oh.
Shiva, what you are not understanding is that where the leg is joined, the bones of the leg is joined to hip, that which cannot move is yin, isn't it?
Yes.
The farther you go from there, more yang it will be. Yin is no movement. Yang is movement. So feet, bones of the foot, that is maximum yang. Can you see? Now, can you get it?
Okay.
This is very simple, yeah. Now, in the feet, if you want to have energies of different metacarpal bones, metatarsal bones, how will you have it? Okay, so let us see. This is your foot. Once you go in the foot, there are bones, many bones. How can you divide it? And how can you suppose in one bone you want to reach and treat? How will you divide it? This is big toe. This is heel.
चारों फिंगर को हॉटनेस दे दे।
चेतन भाई बोलिए।
चारों फिंगर को हॉटनेस दे दे।
बिल्कुल कर सकते हैं।
और
So
और
one
जो
of the methods will be progressive or linear distribution. How can you divide linear distribution? Linear distribution means you can call these hotness, and the heel you can say is
cold.
coldness. And this you can say as hotness. Then here this will be heat, right? What is this point? Which point is this? This is
Heat.
banyan. Which point comes here? केतन कौन सा point आता है यहाँ पे?
SP2.
SP2, SP3. So this will be SP3. ठीक है? Then here which point is here, Ketan?
SP4.
SP4. So this will be what? What energy you can say this is?
Wind.
Wind.
And the junction of all metacarpal bones, metatarsal bones, junctions, that is where the bones are meeting, this area is what?
Humidity.
Humidity. So now you can do, you have understood how we are doing it. Then this one is dryness. There can be yet another kind of distribution of chi here. What? How will you? This side that is big toe side is yin. And this side is yang. Shiva, do you follow?
Yes, sir.
Outer side of the foot is yin. Outer side of the foot is yang. So now on the yang side, there will be 3 energies. And on the yin side also, there will be 3 energies. So what we can do is, we can divide it in 2 parts. So what we can do? This portion is which
Hotness.
energy?
Hotness. Yang वाली. Humidity है.
This is
Humidity.
hotness, right? And similarly, this portion this is humidity. Then
So somebody is waiting in a waiting room.
can I help him?
Yes, sir. Adi is a waiting room. Adi Acupressure. Ayurveda, sorry.
How many times she has come and gone?
So she is facing an internet problem. She is saying that.
Should come in time. So this is their area. Then comes this area. And there is another area. Now you know 3 yang energies on yang side and 3 yin energies on yin side. So this will remain coldness and this will become what? This will be wind. And this will be on this side. What will you have?
Coldness.
It is quite simple and easy. Now that you have understood, this whole area is heat. Which area? This is heat. And this area
Behind us.
is dryness. And this area is coldness. Shiva, are you getting it?
Yes, sir. But my question is, what basis you are dividing this? Like previously, you are dividing like one size, but now we are dividing the size is large. So what is the base?
There are different bases. Always remember, there are 3 yang energies and 3 yin energies. Now, before I explain to you, you have to explain to me what is the difference between yang and yin, Shiva.
So yang is movement, yin is no movement.
Yes, one. What else? There are a dozen of differences.
Yes, yes.
And therefore, you can divide the whole thing in 2 in a dozen of ways. And every time yang will have 3 energies, yin will have 3 energies. That is the basis. The basis is you must know what is yin and what is yang. Left is yang, right is yin, out is yang, yin is yin, bottom is yin, top is yang. So all these ways you can divide. Hello?
Yes, sir. I understand that part.
The beginning of the process is yang, the end of the process is yin. That is another way. These are different bases. So many ways in which you can divide yin and yang. And every time when you have 2 portions of the foot, the yin will have 3 energies and the yang will have 3 energies. So this can be divided in so many ways. This foot itself. Right? The sole portion will be yin and the dorsum of the foot will be yang. So the 3 energies on the dorsum will be yang energies and the 3 energies on the sole will be yin energies. Again, you will say, what is the basis? How have you sliced? Because you do not understand what is yin, what is yang. Unless you know what is yin, what is yang, nothing you can do in acupuncture. And if you are doing it is only hit and trial, it is only fluke. I have cured cancer, people will tell you. How have you done it? Cancer is yin or yang? Tell me. They don't know. I don't consider them to be a good therapist. No. People have been doing it. These points are used for this. That has been done by someone else thousands of years, hundreds of years back. You are copying it. What do you know? You should know. If you know basic yin yang, finished. Nothing else is required. For diagnosis, regional diagnosis, we are always using the concept of yin yang. Nothing more, nothing less. Now, yin and yang yang is hot, yin is cold, yang is bright, yin is dark. There are so many ways you can divide. And every time yang portion will have three energies, wind, heat, hotness, and yin will have three energies. So now why are we trying to divide in so many ways? That should be the question. The answer is that we have to see the status. Status means in terms of ailment. One of the portions is ailment. Which portion is ailing? Which portion is diseased? Which portion is painful? Right? Is that in the whole foot? Then the whole foot must have one energy. But if it is only a small portion in the foot, then the status of that portion must be different than the status of rest of the feet. But if there are two on the outer side and inner side, both sides of the foot, you have similar problem, then the left and right, in and out of the foot, they should have the same energy. You should divide the foot in such a way. So different kinds of divisions we require to allot different energies of similar status. Same status means same disease.
Sir, but the ailment, the patient can observe it and then can they say clearly? Because based on their ailment areas, like say if the pain is there, if you take food, say the pain is there till what level the patient can observe that pain and say to us.
Obviously, you can ask him or her, where is the pain? Show me the pain with your one finger. What will you tell her or him? Show me the maximum painful area with one finger. Okay. So she will or he will show you. Either he will show you full meridian. So you will know the meridian. You don't have to care for anything else. All job is done. But if they say that only my small toe is painful. No, the status of a small toe has to be different than the rest of the toes. You have to divide like that.
Okay. Yeah.
Okay.
Okay.
Revise yin yang. Yin yang, anything and everything, whatever is in the ambit of medical condition, you have to bring it and understand it in terms of yin yang, so that you should be able to treat anything.
Sir, I have one doubt, sir.
Yes.
Sir, if all the joints are pain, like wrist joint, elbow, shoulder, at a time, both leg, knee, ankle, hip, in that case, how to bring all these joints into one form of energy, sir.
Yes, you have to give one energy to all the joints. Yes, very good.
Yes.
Let us ask Shiva. He seems to be a very good thinker. Can you answer, Mr. Prakash? All joints are painful in the body. So all joints must have the same status.
Sir, all the joints are wind.
Yes, Sonia, you know it. Prakash,
Sir.
joints are which system? First, you should catch hold of the system, skeleton
Okay.
system. That is
Skeleton. Okay.
skeleton system. So which meridian for this system?
Kidney.
Now, skeleton system will involve all bones, every bone. Right? The bone here, the bone here, the bone here, the bone here, the bone here. All bones are in kidney and UB.
Yes.
In that bone also, joints. In that bone. Now, in this skeleton system, you can give two kinds of things. You can see joints, one thing, and rest of the bone, different status. Right? So what you can do? Joints, all joints are what? Joints are that which can open, close, go,
Close.
this, stop, start, stop, start. All joints are stop, start. What is that energy? Shiva.
Wind.
Wind. So all joints are wind. So you will rent wind point on kidney. Right? All joints are painful means, is it moving or not moving?
Moving.
It is moving, but it is having some pain. That can be a condition. But one of the joints may be stricture, it is not opening at all, it is not moving. Then that joint will have to have a different status. You must see if there is a difference between the joints.
Joints.
If
Okay.
there is a difference in the condition of the joints, then you have to allot different energies to the different joints.
Pain
But
is
if
common in all joints.
joints
But
are equally painful, heaviness and a little pain, then what you can do? They are moving all right, but with a little uncomfortable situation. What it can be? It is humidity. No movement and movement. It is the junction of the two.
junction.
All joints painful, you will get such things. You will get this. You will get such patients. Sorry, joints painful. Hai. Simple. Humidity sedate, wind tone. कुछ करने का नहीं. And if it is a chronic problem, then humidity sedate on the yin meridian and wind tone on yang meridian. You remember the shoe points?
Yes, sir.
Stream points are supposed to be working for joints. Remember this? Level 1, level 2. If I have done, I don't know. But all books, they discuss this. Okay? Well points, what they do. Spring points, what they do. Stream points, what they do. You know it? We can do it in level 1 or level 2. You can come back again.
Yes, sir.
Remember, whenever you are repeating the same subject, you are liable to get a heavy discount somewhere around 45 to 50% in the fees. I always encourage people to repeat. Sometimes if someone tells me that I don't have money, sir, don't pay, come and join. No problem. I always encourage you to join and learn. That is more important. Shiva, you got it?
Yes, sir.
Shall
I
we
got
go
it.
to something else?
Yes, sir.
Huh? And now it will be easier. When we go to something else, it will be easy. Now you know how to do it. Yin, yang, and then yang has 3 energies, yin has 3 energies. Simple. So there can be many ways. Heart, we decided to divide in 4 ways. Parksab has done it in 2 ways. If you care to see the same book, that 6 energy. 6 energy theory. We divided it in 4 different ways, heart. And we can divide in more ways than that. We can divide. Not necessary. This is not the end. So let us see. Let us see. Shiva, have you taken this screenshot?
Yes, sir. I have taken.
Okay. So then we can go to next. Let me see. I have downloaded 2-3 things. Let us take this. What is this? I can't see it. Now I can see. Yes.
So, sir, please share your screen, sir. Screen one, I haven't taken the snapshot. Please share your screen.
Can you see this?
Not this one, sir. That whatever you have drawn.
That lower limb.
Yes.
This one.
Yeah, yes, sir. 1 minute.
Shiva, this is what you want?
Yes, sir. Yes, yes. Yes, sir. I have taken, sir.
Suppose you have similar problem in the toes on both legs. Can you tell me, Shiva? Let us understand it properly instead of going to the next step. By looking at this sketch, it comes to my mind. How will you do that? Both legs. Both legs and the toes on right side and left side, all of them have similar problem. How will you do? What will you do? Or maybe all the toes you have on one side problematic and on the other side you don't have a problem. How will you do? Let us take one first.
Okay.
And on left side, you have no problem. And the right foot has the problem. How will you decide? How will you do?
I apply cyclical
Yes.
circulation.
Yes,
In
very
that
good, Shiva. Well
left
said.
side, I start from wind, heat. Sorry, bottom one is humidity, dryness, wind.
No.
Or bottom one is wind, heat, sorry.
You should start from your hip joint.
hip joint. Then
to knee
hip
joint
joint
on
is
the left side is wind.
wind. Okay. Hip
Then
joint is
knee to
wind.
ankle joint is heat.
Heat. Okay.
And the left foot is hotness. Right foot is humidity. Simple.
Yeah.
Go like that. 3 energies on the left and 3 energies on the right. Left is yang, right is yin. ये समझ में आती है ना केतन भाई, आपको समझ में आती है ना?
हाँ सर।
केवल राइट फुट में अगर प्रॉब्लम है तो क्या करना चाहिए?
दोनों पैर को जोड़ दें।
हाँ, लेफ्ट से शुरू करो विंड, राइट में कोल्डनेस एंड करो। ठीक है ना?
Okay, sir.
तो हाथों को जोड़ के
मान लो सपोज both feet and all toes on the right and all toes on left, that is left and right, all the 10 toes, the upper portion, the distal portion of the feet, he is having similar problem, same problem. Then what should you do? How will you do that?
Linear.
You can do linear. Yes, you can do. That is one of the ways. Another way is that the pelvic region, which is inside whole pelvis body, that you take as coldness. See, I shall show you. Right? And one of the foot Suppose you have problem. Can you do it? Both these. So both these are affected. So what you can do? Divide vertically, linear. Shiva, can you divide? This will be
Yes, sir. Coldness.
coldness. And what will be this?
Hot.
This will be hotness, isn't it?
Yes.
Now two energies here and two energies here. You know it. This will be wind. This will be heat.
Yes.
What will this be?
Humidity.
And what will this be?
Wind.
होगा ना? Is it all right? Not difficult? Is it difficult? It's not difficult. Now suppose you have only this portion as only 1 foot. If you have, you can do that also. I believe there is no difficulty. You can have wind, heat, hotness, and then this one be humidity, dryness, and coldness. You can have this also, right? Okay. Suppose you have only the toes of the both feet problem. What will you do? Only toes, not whole feet. So toes have to be given a different energy, and the rest of the feet have to be given a different energy. What can you do? Can you solve it? Hello. Can you do it or not, Shiva?
Yes, sir. I am trying.
You have, what I am saying is, you have this 1 foot and you have another foot. And you have toes in both the feet affected. So these toes have to be given a different energy, and the rest of the feet have to be given a different energy. What will you do? चेतन भाई,
सर
दोनों
फिंगर
पैर
फिंगर
के
को एक
पंजे में
एनर्जी दे दे।
केवल अंगुलियों में प्रॉब्लम है, एक ही तरह की प्रॉब्लम है, सेम प्रॉब्लम।
हाँ तो उसको एक एनर्जी दे देंगे उसको,
कौन सी एनर्जी दे देंगे?
हॉटनेस।
बाकी का फुट क्या होगा?
बाकी की 6 बाकी की इसी तरह करना पड़ेगा, तो जो 2 लेग में किया उसी तरह।
क्या करेंगे? लेट मी आस्क एवरीवन, ऑल ऑफ यू प्लीज पुट ऑन योर कैमरास।
Sir, both legs are fullness. So we will go to kidney. Then both the foot will be, we will divide the both. We can take linear distribution for considering both.
हाँ,
Considering both the legs, we can take a linear distribution.
we can take a linear, we can take a linear, yes, because
And
both are
according to
having
that-
same horizontal. Now when the condition is horizontal, we should try to take linear distribution of. Yes, you are right.
If we'll take linear, then the foot will be hotness.
Top portion is yang.
Yes. Then two energies. So what you can do is, you can start on the left side and right side both together. Right? Linear, horizontal divisions, horizontal slices. Right? So the rest of the foot, where will you put? Whole foot you take as hotness. And in hotness, you take hotness. In hotness, it is hotness.
Yes, sir.
Hotness meridian, either pericardium or
Okay.
triple warmer. Right? And then in that also, you have to take hotness. Either hotness or humidity. If it is a yin condition, hotness. If it is yang condition, humidity in the yang meridians. समझ में आ रही है कि नहीं सोनिया?
हाँ जी sir.
Both foot you have taken as hotness. Now foot you will be dividing into 6 slices again, and toes, the upper end will come in again hotness. So that will be
Again.
hotness of hotness.
Hotness.
ठीक है? Got it?
But what is the system here, sir?
System, you have to decide whether bone is affected, whether skin is affected, whether circulatory system is affected, which system is affected.
Okay, in that system, you have to take art or immunity
The
based on
rule
yin and
is,
yang.
rule is identify the system.
Yeah.
First thing you have to identify. Then comes location. We are only talking of location because our topic is
Just identify the energy in that location.
regional,
Okay.
regional diagnosis and treatment.
Okay.
सर तो इसमें हॉटनेस में भी हॉटनेस की 6 एनर्जी हो जाएगी।
हॉटनेस में भी हॉटनेस ले लिया, फिर उसमें 6 एनर्जी।
6 एनर्जी का डिवीजन होगा।
हाँ, क्यों नहीं? Why not?
हाँ। समझ गए।
अरे आपके पास तो बीजी मेरिडियन है, डरने की क्या बात है? पूरी
सर,
मेरिडियन ले
बीजी-
लो, ची की मेरिडियन हॉरिजॉन्टल ले लो, है ना? हॉरिजॉन्टल ले लो, डायगोनल ले लो, वर्टिकल ले लो. Shiva is new, he doesn't know about BG meridians, but we have options. नहीं,
सर तो नी में भी ऐसा कर सकते हैं ना, ड्राइनेस
why
में भी।
not? नी का देखो, अभी मान लो नी प्रॉब्लम. Suppose you have knee problem. So we will go to joints. Knee is what? Joints.
Joints.
Now in the joints, only knees are affected. That means the knees will have one energy and rest of the joints will have different energies. Okay. So what energy generally knees will have?
Dryness.
If it is vertical, it will be dryness. If only one knee is affected, you will have to take cyclical circulation. So left will be heat and right will be dryness.
सर ये सर्जरी जैसा काम होगा?
कर सकते हैं ना, सब कुछ कर सकते हैं, लेकिन सर्जरी नहीं कर सकते.
नहीं, ऐसा ऐसा
So both the
जहाँ
knees-
सर्जरी की जरूरत पड़ेगी वहां चले जाओ, सर्जरी करवाओ.
So he's saying regional diagnosis is like a surgery.
हाँ, like sliding.
सर्जरी जैसी.
Slices.
Actually, yes.
Small areas. We are separating areas. We are separating it, reaching there and putting the energy treatment.
So I want to
It
ask
cannot
one thing.
substitute surgery. Huh? Surgery cannot have a substitution with acupuncture or acupressure. No. Where you need surgery, go for surgery. And after surgery, you again start doing it. No problem. Before surgery, you can do. After surgery, you can. Surgery, you cannot. If there is a crack of, there is a tear, you can avoid. Many a times you can avoid surgery, but not always. You cannot substitute. You cannot. Acupuncture or acupressure is not a substitute of surgery. They have a plus point, so we have to accept it.
So I want to ask something. So suppose I want to treat both the knees and both the knees is dryness. So can I take K7 spiral also to treat
Why
both the
not?
knees?
Yes, you can. First, you go to the system. Don't forget your rule. System is what? Kidney UB.
Yes, sir.
So you have to go to UB. Why? Because internal, if you directly go to the kidney meridian, then a lot of energy will be wasted in curing kidney. Unless you think that kidney should be treated. And even if it should be treated, you go through urinary bladder. So you have gone to the skeleton system. Now in that, dryness is yin energy. So what is the kind of energy that you require to regulate for curing your knee pain or whatever it is? Generally, they will come to you when they are suggested knee replacement. Knee replacement is suggested only when there is extreme yin. There hardly any movement. They cannot move. They cannot stand. They cannot walk. So that is no movement means yin. Yin hai excess. Yin कहाँ मिलेगी? Kidney meridian में मिलेगी कि UB में मिलेगी? Where will you find more yin chi? In kidney meridian or in urinary bladder meridian?
Kidney meridian.
Kidney meridian. So after coming to urinary bladder meridian, right? Right? So you want to treat what? In urinary bladder,
Trans points.
what is knee?
Dryness.
Joints are wind. Joints are wind. And kidney is yin. So come to kidney first. If you want to come to kidney, you come to kidney first. How will you come from urinary bladder to kidney? Front shoe point of urinary bladder. That is CV3. You read CV3. Now CV3 is connected to UB. And CV3 is connected to kidney. It's a meeting point, you know. All the meridians are meeting at CV3. And it is a front shoe point of urinary bladder. After that, you go to kidney meridian. So now the system is kidney. From UB, you have come to Because kidney and UB, they are same. Because UB meridian has the energy, whatever has been generated by kidney. UB itself doesn't generate any energy. समझ रहे हैं ना?
हाँ सर.
After renting, rent CV3, go to kidney meridian, go to dryness. First you go where? Not dryness. First you go to wind,
Wind.
all the joints. Then in that joint, liver, you go to dryness. Liver 4. Rent liver 4. Where will you go then? Lungs meridian, not kidney. So treatment of knees will call for what? Will call for what? Lungs meridian, not kidney, not UB. And now suppose if synovial fluid is not there,
We will tone yin.
Dr. Shah,
Yes, sir. Yes, sir.
क्या करें?
Yes, sir.
साइनोवियल फ्लूइड सूख गई है नीज में या रप्चर हो गया, डैमेज हो गया है, कुछ भी हो सकता है ना. साइनोवियल मेम्ब्रेन डैमेज हो गया. पहले
Yes,
बताइए
sir.
फ्लूइड नहीं है, साइनोवियल फ्लूइड इज मिसिंग, लुब्रिकेशन इज मिसिंग, देयरफॉर देयर इज पेन. व्हाट शुड यू डू?
Sir, we have to increase yin.
फ्लूइड्स क्या है सोनिया?
Yin, sir.
हैं?
Yin. Body fluids are yin.
Body fluids come in which category? Humidity.
Yin, sir.
Humidity.
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 All fluids come in the category of humidity energy. So therefore you shall have to go to humidity point of lungs and then go to the spleen and treat. Humidity बढ़ानी है, fluid को बढ़ाना है, तो किसको बढ़ाएंगे? Which energy you will tone?
Humidity, sir.
Yes, Dr. Aparna. Anything in your mind? Synovial fluid.
Sir, heat hum
स्प्लीन की ह्यूमिडिटी बढ़ाए.
किसकी?
स्प्लीन की
बहुत अच्छा है.
और स्टमक की भी बढ़ाए.
So you will go to humidity point of lungs, go to the humidity meridian, right? And then secretions have to be there. It is the secretion. Now, secretion means something to be generated and released. Dr. Aparna, do you appreciate this process? There are certain cells which will generate and release a few drops of synovial fluid. So generation and releasing continuously, drop by drop by drop by drop by drop. It is a continuous process. What should you do? Go to spleen, increase yang or
Tone
yin?
fire.
What will you do?
Fire.
Young, sir.
Yes, tone
Yang.
fire.
Yes, Dr. Shah. That is the mistake that people make. They go to tonify yin. It is the yang. So that the dying cells, they will be revived. They will generate and release this synovial fluid. स्प्लीन की केवल ची को टोन करो, अपने आप ठीक होता है घुटना. कुछ करना नहीं पड़ता. Once I went to where I went, I remember Jaipur. There was a camp. I was comparatively very new, and there was a whole team. Somewhere around 8 to 10 people. We had gone there to have a camp. So that knee thing, 1 day, 2 day, there was a camp for 7 days. 2 दिन तक some other therapists were working. 3rd day, a friend of mine who was treating and he was not getting any result, he said, and I tonified the spleen chi. And that was final, the knee pain gone.
सर मैंने अभी अभी किया है, नी में काम किया अभी इसी तरह।
हाँ, आप कर सकते हैं, आप तो करते हैं, जैसे ही आपने पढ़ा वैसे ही तुरंत अप्लाई करते हैं।
हाँ मैंने कर दिया, मैंने पहली बार ऐसा स्पीड से रिजल्ट देखा।
होता है। So you should know exactly what kind of a problem is there in the knee. Ligament tear somewhere around gallbladder 34. नहीं, खेलते खेलते होता है ना, बैडमिंटन खेलते हुए, लॉन टेनिस खेलते हुए, people will come to you. Ligament tear, क्या करें? What should you do? Shiva, any idea?
Ligament tear.
The ligament is connected with the liver.
Very good. Well said.
So again, from kidney, we will go to rank K1 and go to liver for the treatment.
Ligament means system is liver.
लीवर।
Liver.
Okay.
Now you go to location. There are ligaments on in every joint. So like joints only, knee will be both knee, it is dryness. Left knee, it is heat. Right knee, it is dryness. So in liver, you go there. Then
सर विंड को सिडेट करेंगे, ड्राइनेस को टोन करेंगे।
which meridian would you like to treat? What will you like to treat? What is the condition? You have gone to this. Okay. Left knee ligament, it is heat. Right knee ligament, it is dryness. Suppose you have gone to right knee or left knee. Take any knee. Now you have reached there. Dryness. Now what do you want to do? What has happened there? So liver
Sir.
4 rent किया, मान लो dryness है. Now then you go to lungs. Now what you will do?
सर विंड को सिडेट करेंगे, ड्राइनेस को टोन करेंगे।
Now wind is yin or yang?
यांग सर।
यांग।
Yeah. Where will you find more yang? In the yang meridian or yin meridian?
गॉल ब्लैडर, ओके, बैक शू
Huh?
पॉइंट।
Which
Yes,
meridian
sir.
you will find more yang?
गॉल ब्लैडर बोल।
नहीं एलआई में जाएंगे।
ओ सॉरी सर, ये एलआई में बैक शू पॉइंट ऑफ लंग्स।
एलआई में जाएंगे।
LI में आएंगे तो कहाँ जाएंगे?
विंड में जाएंगे।
Be very careful how you do it.
तो लीवर को रैंक किया है तो लंग्स में ही जाएंगे, फिर वहां से फिर हमें लार्ज इंटेस्टाइन
अगर
में
लीवर
जाना
में जा
पड़ेगा।
रहे हैं तो गॉल ब्लैडर में जाएंगे, अगर लंग्स में गए हैं तो लार्ज इंटेस्टाइन में जाएंगे. Always remember that yang chi is available in yang meridians and you can go from yin to yang and yang to yin. How? With the help of front shoe and back shoe point, non-conventional use of back shoe and front shoe, which is not discussed in any book, but I have explained it properly to all of you. Is it okay?
Yes.
Are you getting it?
Yes, sir. We will rank UB13 and go to
हाँ?
LI.
क्या?
UB13 रैंक होगा सर, जैसे लंग्स में आ गए तो वहां से हम UB13 को रैंक करेंगे टू गो टू LI.
हाँ, UB13 करेंगे, क्योंकि every kind of cheese made only by these organs, 6 organs, और कहीं जाना ही नहीं है. किसी भी प्रकार, hundreds of varieties of cheese we are getting only from these 6 generating organs. Remember this. ठीक समझ में आ रही है कुछ? हाँ.
फिर जो लिगामेंट टियर हुआ है उसका क्या प्रोटोकॉल?
Ligament tear, anything tear, any fracture, any separation, Separation is what?
Wind, sedate.
Wind. Yes.
And the controller dryness will
Sedate
be
wind.
gone.
And if the pain is radiating or something like that, it is longitudinal, if it is tear is increasing, वो देखने चाहिए तो हीट भी ले सकते हैं.
सर अगर ये सर अचानक यहाँ पे चोट लग जाती है राइट एल्बो में, तो उसको हम कैसे
चोट
करेंगे?
is what?
Clockwise.
Trauma. First
Clockwise
hit,
करेंगे.
the blow. When you get a blow, what is
Blow.
it? It is wind.
विंड. सर ये विंड बन जाएगा ये वाला, तो फिर हम क्लॉकवाइज इसको एनर्जी को डिवाइड करेंगे. क्लॉकवाइज.
जब एक ही हाथ में है तो क्लॉकवाइज आपको साइक्लिकल करना है. When you see, always remember, we can divide your body in so many ways. Try to find out how we should do it.
ये विंड है सर अगर, तो फिर ये
Agar if you have only this problem
yes,
and you don't have a problem here,
yes, yes.
whole joint is not involved, you have only hurt here. Which meridian is going here? Large intestine. Take large intestine meridian. Another fundamental thing is that whichever meridian is passing through the area of ailment, the treatment of that ailment will be through that meridian. Why are you bothered about other meridians and other things? You are finding a meridian here. Simple. नहीं समझ में आ रही है.
आगे सर, आगे सर समझ. लेकिन अगर सर ये पूरी एल्बो हो, तो फिर हम कैसे डिवाइड करेंगे?
पूरी एल्बो तो फिर जॉइंट में जाने पड़ेगा.
तो
Both hands. Both hands are what? Both hands are wind. Both hands are
विंड.
wind. Now in wind, right side and this left side. So this is wind, heat, hotness, humidity,
Dryness.
coldness. This is hotness. This is heat. So if right side is dryness, so again come in dryness. In wind you come to dryness. And then in dryness you treat. If it is wind, go to LI, sedate wind, LI3. Sedate humidity. You can sedate if it is there is swelling, etc. If you find swelling, lot of heat is there. So you can sedate heat and humidity. Depending on what kind of problem is there.
Okay.
There is a tear, there is a crack, hairline crack, sedate wind. But no, there is swelling, redness, temperature, elevated temperature, sedate heat and humidity. Heat, humidity will make huge yang. So, कितनी बार बताया है level 1, level 2 में? Oh,
Yes, sir. Yes, sir. बताया
time
आपको.
again I've been talking about it.
Yes, yes.
ठीक है. आज तो हमने 3-4 रखा हुआ था करने के लिए. Somehow we have not been able to do. Tomorrow we will do. Tomorrow we will do lungs and we will do digestive system both. ठीक है? So, shall we close it?
Yes, sir. Yes.
Yes,
Yes.
sir. Good night, sir.
Good.
Try
Good
to
night.
come in time, Jagneshwar.